Hey, I'm Rebecca, a PhD student currently working at the Institute for Regenerative Medicine in Zurich, and I'm very happy to present you the following work, which evaluates BBB permeability following photothrombotic stroke in mice. Blood-brain barrier damage is an important pathophysiological feature of ischemic stroke, and it significantly contributes to the development of severe brain injury. It's therefore a very interesting target for therapeutic intervention. Blood-brain barrier dysfunction is normally characterized by alterations to tight junction proteins and damage to cellular components of the neurovascular unit. A popular model to study long-term recovery following stroke is the so-called photothrombotic stroke model, which is a model of occlusion of small superficial vessels, providing very well-defined size and location of ischemic lesion. However, BBB injury has not yet been studied beyond the acute phase or acute stage so far in this very model. Here we provide a 3-week time course of BBB permeability changes in mice subjected to a cortical photothrombotic stroke. Now, breakdown of the blood-brain barrier normally occurs within the first days in stroke patients. We therefore first evaluate the integrity of the blood-brain barrier 24 hours following stroke using Evans blue, which is a BBB permeability marker. So Evans blue binds to serum albumin, which does not cross the intact blood-brain barrier. Now, 1 day following stroke, Evans blue signal was significantly increased in the stroke course, shown here in pink, and also increased in the peri-infarct region, shown here in yellow. In the next step, we aimed to characterize the spatio-temporal profile of BBB permeability in a 3-week time course. And interestingly, all animals showed enhanced leakage shown by enhanced Evans blue signal, but only 24 hours after stroke induction, but also 7 and 21 days after injury in the ipsilesional cortex. In the contralesional cortex and also in ipsi and contralesional hippocampus, we could observe enhanced leakage 24 hours following stroke. We then performed a histological analysis of vascular permeability to explore the spatial distribution of Evans blue in the injured and the contralateral cortex. And the area of Evans blue leakage in the stroke core decreased slightly over time. And the signal in the peri-infarct region, here shown in yellow, which is just next to the ischemic core, steadily decreased from day 1 to 21 days following injury. So, in conclusion, most damage and vascular permeability in the photothrombotic stroke model is present at the site of injury, and it weakens gradually over time up to 21 days following stroke. We also checked for tight junction protein and pericyte coverage. And what you can see here is the surface of, or the surface ratio of blood vessels covered by junction protein components, which significantly decreased in the peri-infarct region, shown by claudin 5, B-cadherin, and so on staining. Taken together, the photothrombotic stroke model shows many features of BBB disruption that have been previously observed in stroke patients and also in other rodent models of experimental stroke. So it therefore represents a very suitable model to study BBB pathology and to develop therapies to improve barrier integrity following stroke. I want to thank the people shown here, some of them from Rustlab and some from Rustlab. They all have contributed to this work. Thanks.